Back to school has been challenging for parents and students with many changes due to COVID-19. Changes including masks and classes split between the classroom and online or just simply online. And today we're joined by Tennessee Health Commissioner Dr. Lisa Piercey to talk about COVID-19 and back to school. Dr. Piercey, first, thank you so much for joining us here on this Friday.
Thanks for having me and shedding light on this really important topic.
Of course. Now, first, a big question for you. What do parents and students need to keep in mind when they are allowed to return back to the classroom?
Yeah, that's a great question. And, the answer is really not any different than what they would do on a typical daily basis. Now, we do have some extra precautions because kids are in a classroom together, but the principles are the same. Spacing out, creating distance, wearing your facial covering, aggressive hand hygiene, and avoiding activities that aren't absolutely necessary. And so we know that when teachers practice these good habits as well as students, we can really lower the risk when we put kids back in the classroom.
Well, that's good to hear. Now, the state has previously suggested that districts use threshold numbers of cases per 100,000 of students to determine who should be in the classroom. And now it seems that the state is backing away from that. Why exactly is that?
We've actually never recommended that be used. We know that our nursing home visitation threshold that's on the website has been used, but that's never been endorsed or promoted by the state. We believe that every child should have the option of being in the classroom whenever possible, because the benefits of in-classroom learning extend far beyond education. You've probably heard me say before about the nutritional effects and physical health effects, in addition to social and emotional well-being, as well as child safety. And so we encourage all school districts to provide an in-person option, and understanding that some districts will choose not to, but we think it's important for parents to have that choice.
Well, one thing that has been discussed is that many parents have to have help with contact tracing if their student tests positive and is at school in person. How realistic is this contact tracing with students and parents?
It's actually a lot less complicated than it might sound on the surface. Really, the only information we need from parents and students or teachers, if that's the case in schools, is, hey, who does your kid usually hang out with or play with or gravitate towards? We just need parents' help in identifying who the child may have been exposed to. Obviously, teachers will have a great insight into that. They'll know seating charts and movement patterns in the school, but the parents might also help with that and can also help us alert contacts of that child to say, hey, I just wanted to let you know you might be getting a call from the health department, but I'm giving you a heads up that my child is tested positive and yours may have been exposed.
The Carter County Board of Education here in Northeast Tennessee voted to suspend all extracurricular activities, including athletic practice, as a precaution. Is this move something that you think other districts should also consider to prevent the spread of COVID-19?
The thing about our school districts in Tennessee is that they are very widely variable. We have very large ones, we have very small ones, and we are pretty staunch advocates of one size not fitting all. We believe that those decisions are best made on the local level, and we'll support districts where they are in that decision making. Because there are a lot of parents that need to go back to work and they need that predictable scheduling, as well as they may need some of those social and nutritional supports that I mentioned earlier for their child. We do strongly recommend an in-person option, but understand that some districts may not choose to do so.
Well, right now we are seeing a large increase in the number of new cases of COVID-19 in our region. Is there a concern that children going back to schools could make this spread even worse?
The fact of the matter is we know that there are going to be cases in schools, and whether it's in school or whether it's in the community, the practices are the same. You lower your risk as much as possible by doing those very basic principles. And if you are ultimately not comfortable sending your child to school, then you should have the option to stay at home with the child. So we feel like those are both really good options. And because really, as a parent and as a pediatrician, I'm a firm believer that there is no one person that knows their child better than the parent. And so parents make the best choice for their kids, and we want those parents to have a choice.
Fantastic point there. And I'd like to touch on something that's not strictly school related right now. Previously, the TDH had released guidelines that if you want a COVID-19 test to get one. Now, are you all saying that you only get a test if you have symptoms? And how challenging is the shortage of tests if we're seeing one?
No, ma'am, we haven't changed our guidance at all. You can still get a test at any of our 89 rural county health departments, whether you have symptoms or not. I am aware that there are multiple clinics and providers that have gone to symptomatic testing only. That's a reasonable step when we're having such difficulty with lab throughput. But at the health department, we have never backed away from, if you want a test or you think you need a test, you can come get a test for free at the health department. And I want to clarify something. We're actually not having a shortage of test itself. The main issue that we're running into in Tennessee, it's the same across the nation, is what we call lab turnaround time, which is once the test gets to the lab, how long does it take to get processed and get a result? And, that's just a simple supply and demand problem. The demand has gone up nationally in an exponential way. And so labs are having trouble keeping up. I have to remind myself, and I'll remind your viewers, nobody was doing this test before February or March. And so it's taken a while for the labs to get scaled up. And because everybody in the nation is creating this demand, some of the lab supplies are in shorter supply, something we call reagent, which is the chemical used in processing lab tests. And sometimes the disposable equipment used to transfer lab samples can be in short supply. We're not seeing that in a very dire shortage right now, but we are hearing reports of that. The good news is that over the last week or two, labs have really stepped up to the plate. They've brought on more employees, many of them in a very expensive contract agency, but they've done that in order to try to be able to process more tests. They've extended their operating hours, and so that's really helping with our throughput.
So now a quick follow-up question to that. You mentioned the shortage of tests right now, and in some areas here we're seeing about 10 to 14 days to get those test results. What do you say to people who are saying, well, I might as well just not get one then?
Yeah, that really concerns me. If you're well and you haven't been exposed, in that situation, you probably don't need a test. But if you're feeling ill, and particularly if you're feeling ill and have been in contact with someone that is infected, it is of critical importance that you get the test. And you're right, at some point, there were 10 to 12 day lags. That's really a lot lower now. And so we're seeing it getting back to normal, probably more in the 3 to 5 day range. And I'm hopeful that it'll be even less than that soon. But the take home message is if you are sick, you need to be tested.
Perfect. Thank you so much. Is there anything else that you'd like to add before we go today?
I always end with a reminder of this is a stressful time for everyone, and it is a completely unprecedented time for everyone. And talking about schools specifically, we're asking school administrators and teachers and districts and parents to consider and do things that they have never done before. And frankly, probably never thought, ever imagined that they would be doing it. So now is the right time for flexibility and grace and patience, because we're all learning as we go. And there are going to be some bumps along the road, but they're working really hard to get kids back into school and do that safely for both students and teachers. So we need to give our school administrators a little bit of grace and flexibility.
It's a learning experience for all. Thank you so much for joining us here this afternoon. We really appreciate it. And if you are just tuning in or missed part of our interview with Tennessee Health Commissioner Dr. Lisa Piercey, we will have that interview online at WJHL.com. Thank you again for joining us.
Thank you.